really my pleasure to welcome you to our fourth season of Critical Dialogues for Action, series that Sana Kondu and the Equity and Health Systems Lab and the University of Manitoba Faculty of Rady Faculty of Health Sciences has been hosting over the last number of years. It's our pleasure to have you join us for our first session of this season. And we're really looking forward to the dialogue that we are going to engage with today and really explore some new ideas with you. And thank you for taking the time out of your busy schedules to joining us. If I haven't had a chance to meet you, my name is Jerry Maniat. I'm the founding director of the Equity and Health Systems Lab and a general internist here in Ottawa. We're very fortunate to live where we are and to play the roles that we do where we are. But I think it's really also important that we acknowledge that the spaces that we find ourselves are often not are not often ours, and this is really important as we strongly consider the diverse places where our attendees and participants are coming for this session. And we recognize that we are in an online space, and so it's difficult to really have a single land acknowledgement that captures that richness. I would ask, though, that you take the opportunity to contemplate, to think, to reflect on your responsibility of reconciliation with Indigenous peoples who live where you are and whose ownership and stewardship of the land predates our involvement here. And also to strongly think, what role do we play? What role do I play in reconciling the truths of the past traumas and the current and future harms that many of them are still experiencing, and how we in our health system space can really take an opportunity to make an effective change in that space, not only to just advocate and speak up, but also to act in those opportunities that we find ourselves. So I would ask you to, at this moment, just take a couple of moments to just consider that as we pause. Our series is an accredited series. It's been approved as Section 1 credits through the Royal College of Physicians and Surgeons of Canada. Upon completion of this session, we will be sending out certificates to attendees so that you can keep them in your dossier and submit them to either the Royal College or your respective educational and accrediting bodies. We would encourage you to use social media for sharing the reflections and the lessons that you've learned this evening. We would encourage you, however, not to share the specifics of stories of individuals as they are quite personal, unless, of course, they are your own. If they are, please feel free. If not, please share the reflections and the key concepts that you're learning this evening. And please use the tags that we've listed there and the hashtag. We will be recording the session, and this is partly because we will be exploring making educational content from this. The concepts that are being taught this evening and shared, and so we will be recording this content for that purpose. We would encourage you to keep your microphones off as to maximize the audiovisual quality, and we will be keeping an eye on the chat feature for questions that will be raised, and our facilitator will be sharing their screen, so there will be an opportunity to have that engagement with content. This evening, we are really excited to have, as I said, our first session for this series session called Voices from Palliative Care, the Perspectives of Caregivers, Patients, and a Storyteller. And we're really fortunate to have with us this evening our three speakers. Kim Kilpatrick is a professional storyteller, and she's been storytelling and teaching workshops on storytelling for more than 20 years. She has 3 one-woman shows about blindness, living with guide dogs, and living through COVID as a blind person. Kim is also an accessibility consultant, tech trainer, and so proud to be an artist with Radical Connections and with MASC. Kim has traveled the world and currently is involved with the palliative care unit with her 5th guide dog, Yellow Lab Ginger. Caitlin Bowes is a palliative care physician and is currently working at St. Joseph's Healthcare in Hamilton. She was previously involved with the team at the Briere Palliative Care Unit and the Regional Palliative Consult team for 3 years before she departed to Hamilton. But she's still very actively engaged with this project, and it's exciting to have her as well be here with us. And Jenny McMaster is involved with Radical Connections, and she's been helping us coordinate and pull this session together. And with that, I'm actually going to stop sharing my slides, and I'm going to hand the microphone over to Jenny to kick us off with our session, and Kim and Caitlin.
Hello. Thank you, Jerry, for that wonderful introduction. And just before I get started, to let everyone know, for the benefit of our blind and low-sighted participants or people in the audience, I am going to be reading the content of the slides along with giving my short presentation before we start the panel discussion. So on this slide, on the top banner, it says Critical Dialogues for Action, Voices from Palliative Care, the Perspectives of Caregivers, Patients, and a Storyteller. Collaboration between Radical Connections, the Briere Palliative Care Unit, and the Briere Research Institute, with Dr. Caitlin Bowes and storyteller Kim Kilpatrick from Radical Connections, and moderated by me, Radical Connections Artistic Director. And on the right, we have a picture of Jaya Rastogi, who is the current research coordinator, and Kim Kilpatrick and her dog Ginger and Caitlin. So for those of you who are not as familiar with us, Radical Connections is a not-for-profit whose mandate is to provide arts programming for people in hospitals and long-term care, as well as people in care in the wider community. And we are devoted to advocating for the recognition of patients and residents as whole people, attending to their hearts and minds through stories, music, and art, which is why we are so delighted to be collaborating with the Briere PCU, which is not only very caring, but also open to new creative approaches. So I'm going to speak a little bit about the participants in this project. So principal current applicant is Jessica Roy of Briere Continuing Care. Before our principal applicant was Caitlin. And our co-lead, the wonderful Serena Eisenberg, who is in the audience from the Briere Research Institute, and she is the chair mixed methods in palliative care research. And it's wonderful that one of those mixed methods is the arts. And our co-applicants are Dr. Carol Weeb of Radical Connections, the executive director, me, Jenny McMaster, Radical Connections artistic director, and Dr. Shirley Bush, Briere Continuing Care in the Ottawa Hospital, who is a clinical investigator, and Ms. Kim Kilpatrick, a professional storyteller. Ms. Jaya Rastogi of the Briere Research Institute, research coordinator. Formerly, this was Miss Madeline McCoy, who was with us for quite a long time, so we just wanted to acknowledge her. And I would also like to acknowledge our collaborators, Dr. Corey Imroom of the Mayo Clinic and Ms. Claudia Hampel, caregiver advisor. This project, the palliative care and storytelling project, kind of has been going on and slowly evolving the whole time I've been at Radical Connections. I joined in about 2021, and from seminal idea until we got the Briere academic medical organization grant just recently, in which point things really got started. So I have here on the slide the timeline. So this year, between February 2023 and March 2023, we were busy getting research and ethics board approval and planning the initiative. In April 2023, we were setting up data collection and recruiting our participants. And so now it's very exciting. From April to September of 2023, Kim Kilpatrick has been going into the palliative care unit and writing stories with the participants, the patients, the family caregivers, and the staff in the PCU. Between September and November, we'll begin our content analysis of the stories based on the field notes, descriptive analysis of survey data, qualitative interview with the storyteller, Kim, and analysis of interview data. And then between December 2023 and January 2024, we're going to have some arts-based knowledge translation in the form of a film by Kim Kilpatrick and Rachel Gray are going to collaborate on that. We'll have some conference presentation and a submission of a publication. The basis of this whole project is hopefully we'll collect 30 stories from the palliative care unit, 10 staff members, 10 patients, and 10 caregivers. There is some wiggle room here on the numbers. And so the original methodology going in was the 55-word story. So the 55-word story is a tool which Dr. Corey Ingram, who has helped us out with the project, has used in past projects as a writing tool that helps participants to articulate the essence of what they're hoping to convey. The participant is asked to write freely without attention to spelling, grammar, and perpetual self-editing. And there are no rules other than pulling out only what matters. So Corey Ingram and Claudia Hampel developed this model with the Ottawa Hospital, and Jerry is very familiar with that because he was involved in all as well. And they developed a patient experience storytellers booklet, and I also have a link there which we can share in the chat at some point if people are interested in going to check out this book. However, Kim Kilpatrick has really made this project her own and taken her own approach to this, kind of taking off from the 55-word story, but really developing things in her own way. So I am now going to stop share and turn things over to Kim Kilpatrick.
Thank you so much, Jenny, and thank you for describing the slides. That's wonderful. I noticed a few of my blind friends have joined us, so that's awesome that you did that. I'd just like to point out the timeline is changed a little bit because we had to delay going into the palliative care unit until July. We did our first story in early July because the palliative care unit moved, and we waited till after that. So if I tell you now that we have now collected 12 stories, it's not that we're behind, it's that we sort of shifted things a little bit there, which we have currently collected 12. And we are going to do, I think, 3 more this week, perhaps. So it's rolling along quite nicely now. So back to the 55-word story. So when I heard about the model, I thought it was a wonderful model. But I was a bit concerned about the writing part of the model and wanted to make sure that we had a very flexible and accessible model so that everyone could participate. So no matter what their abilities were and whether they could participate. As well, because I'm a storyteller, storytellers are oral artists. We don't read when we present. I am reading tonight. I'm reading in Braille. So if you do see my hands moving and things, I'm using a Braille computerized device to read my notes. But when I do perform stories, I don't read them, but I am reading them tonight. I want to be really true to the words that we have created. So I just wanted to make sure that most participants could participate in whatever way they felt comfortable. As we know, people in palliative care, they might not be able to write anymore or have the energy to write. So we wanted to make sure that we had all options available. So for example, when the 55-word story involved, as Jenny said, people will write with the pen and paper, just free, quick writing down ideas. And that's actually what Caitlin did do. And then the next direction would be to go into one idea and make a story out of it. But no one has really done their own story right off the bat. So Caitlin did the initial writing, and then she and I had a conversation about the ideas she had, and I asked some questions and we formed them into a story. But I was really concerned about the accessibility of this whole process. So when I did it in a workshop with Dr. Ingram, I used my Braille display to write, and I did it in the normal way, except that it was in Braille, so only I could read it. But I just wanted to make sure that when we did this, we would make everyone equal. So what they have now is the following options. The participant can write their story with a pen and paper. So far, Caitlin has done that. Write their stories on the tablet or laptop. I don't think anyone, well, one person is doing that. Audio record their stories. No one has so far done that. Compose their stories verbally, and that's what most people have done. I find that what happens is I sit down, they say, I just don't know where to start. And then we have a conversation. I write notes, and Jaya, who's the research person with me, she writes notes. That's for the research process, but we write notes, and then I go away and I craft a story from what they've given me. And then I bring it back. Hopefully, so far, I've been able to bring them all back to people once they've crafted them, once I've crafted them, and show them. And there have been some people who have said, no, this is mostly really good, but you got this wrong. I'd like this changed. But I think Jaya has printed them off for patients and for people. And I think they really see that as a gift. It is a gift, really, for sure. I'm going to begin with one of our stories, and this was told to me by a palliative care physician, and I crafted it into a story. Some staff liked the old palliative care unit better than the new one. They said it was cozy, that it felt warm and friendly. She always thought it was somber and seemed old and a bit worn down. She loved the new unit with its larger rooms and light and wonderful view. She liked the open spaces where you could chat with others. She felt proud of this unit. But when she thought about the old unit and her last shifts there, she thought about him, a well-dressed man who wanted to be a part of all of the decisions made about his care. He had been a volunteer on the unit for 20 years and had started the popular coffee program, which still runs on Thursdays. Many people knew him on the unit. He was even featured in a poster for volunteers, which was propped outside of his room. She told him about the move and that he would have to move to the new unit. He loved this unit. He had been a part of it for so long, and he said he would rather die on this unit. This he did. He had loved this unit as a volunteer and wanted to stay on the unit as a patient. As she moves through the new unit, a part of his legacy is here too, the volunteers he mentored and the program he started.
Thank you so much, Kim. And I think this is going to be made so much more rich because of the fact we are including stories throughout this panel discussion and really showing people the importance of bringing an art form into the conversation. So my first question for you is, what is, I'm answering my own question, but what for you is the advantage of crafting stories over just a series of conversations with participants?
So conversations are wonderful. We all have them every day, and they can result in stories. So conversations are very important. But crafting a story, as I said a few minutes ago, is really a gift. It's a gift to the immediate listener. So to me, when they're telling me things, and it's a gift from me to them back when I craft it and give it back to them. It could also be a gift left for a family member, for friends, and for staff on the unit. And it's a gift for the person to create the story and feel good about it and know that they've been heard. So crafting a story focuses on one event or a small set of characters or something that happened, especially stories this short. Now, none of mine have been 55 words. They're a little bit longer than that, but we try really to keep them simple and short. So our stories, I think the other thing about stories versus conversations is stories have strong images that stick with people long after you hear them. In the previous story, the story I read, the thought of the poster propped outside his room, and he walking the halls as a volunteer and being a patient, and the description, say, of the new unit, things like that stay with you. And so the stories stay with you and you can ponder them long after. I mean, sometimes conversations stay with you, but stories are created from this conversation and sort of crafted into something beautiful and unique. There's emotion in a story. There's an emotion, there's a feeling to a story, which you don't always get in a conversation. I mean, sometimes you can, but there's a mood, a happy, sad, humorous, frustrated. So you can feel the emotion in the story or a series of emotions in the story. You can really feel those. Stories are one of our oldest art forms. They were there long ago, long before a written word. And everyone is drawn towards telling stories. I'm sure all of us here have done it. Maybe not, professionally crafted stories, but we all tell stories every day. And we're all drawn to hearing stories. Everyone is. So it's something that is so universal. Hearing the stories back after they're polished as well shows that people have been heard, that I heard that person, that I took the time to go away and make something of what they said, and then checked in with them to see if what they said was what I had written or what I had created for them is what they intended. So it is a real gift to feel that, I think. Having a physical copy of the story too shows they've been heard and now they've something to hold on to, or families have something to hold on to. Some people, we've said that we're going to email them the stories. These can be caregivers who their family members are no longer, have died on the units or no longer around. And I'm sure like receiving those is I would think is good and something that they can have. It's the same for an audio recording. We haven't done any audio recordings as yet. So I think, Jenny, are we jumping to Caitlin
Yeah.
to read the
Yes.
story she crafted? She
Yes.
gave me the least work of any of the others, so I'm glad.
Hi, I'm Caitlin. I'm one of the I guess participant number one for the project. And as like mentioned, I'm a palliative care physician. I'll have you note that this is my first time reading the story out loud to a new audience, so bear with me, but this is sort of a exciting and thrilling moment. Okay, so here's my story. She bought and installed a new bed at her house as her body shut down in the final months of life on the palliative care unit. This was not an act of denial, but an ongoing commitment to personal growth and an ongoing effort to leave things in a better way than when she found them. She grew in her ability to trust, connect, and be a part of our community, becoming our own unit, gossip queen, and motivational voice. I also grew along with her, bringing yoga and movement into our visits, a practice outside of my usual clinical routine. I hope she knows she left us better than when she found us too.
Thank you, Caitlin. And my question for you is, can you describe the process of crafting your story a little bit?
Sure. So it was an opportunity for me to reflect on a case that meant a lot to me as a physician. It was also a part of my goodbye process for someone who had a big impact on me as a person. I was nervous but excited. I think it's important that we participate in this wonderful opportunity that we're asking other people to be a part of. So I felt it was really important to jump in myself. I also found it was a really healing and enjoyable process for me that really flew by time-wise. I loved that Kim helped me to feel a sense of ownership over my story and getting to refine that final draft. And her being flexible helped me to keep the story mine while also providing thoughtful questions and guidance that helped me to bring out and distill the story down to what was most important, and bring it into a cohesive story.
Thank you. And my next question is also for you. So why do you think, as a physician, the activity of storytelling is worthwhile in a palliative care setting in particular?
Yeah, so palliative care settings are medical environments, but that also are generally quite flexible in considering personal, cultural, spiritual, and community needs. This is one thing that's really drawn me to palliative care. I think, therefore, it's also an environment that lends itself to considering creative avenues to create meaning, support one another, and reflect. I personally feel storytelling lends itself really nicely because I feel we hear stories every day working in palliative care. So a lot of the initial consult is learning about who a person is and how they got to where they are meeting me that day. So we hear lots of stories, as many of the other healthcare professionals on the call do too, about people's journeys through the healthcare system, how they found meaning during the tough times. And really, if you spend enough time in a patient room, you get to hear some pretty interesting stories. And I think it's helpful. It's very fulfilling to me to hear those stories, and it helps me to improve the care I provide to these people, to my patients. And I also think it's important to note that initiatives related to storytelling are not new to palliative care. Dr. Harvey Chochinof's work on dignity therapy also involves co-creation of written stories and documents as well. And so there is a bit of a history too, specifically in palliative care, of formalizing patients' experiences and stories in the written form, and that being important for concepts like dignity.
Thank you,
So
Kate.
we'll take a break to hear another story, I think.
Yeah, yep.
This story was told to me by a caregiver, and it was crafted by me. Through the sudden chaos of illness, hospital visits, surgery, caretaking, he is the advocate. He carries with him at all times a book where he writes down every name, every email, every phone extension of the numerous healthcare professionals he comes in contact with as he and his family travel this difficult road. He has been continuously advocating for his loved ones. Although he knows healthcare professionals are doing their best in challenging situations, he is frustrated, cynical, and has lost his trust in the healthcare system. Being in the hospital, it feels like being in the middle of a raging storm. After this, the palliative care unit was an island of tranquility. At first, he did not know if he could trust the medical staff when they assured him that the patient's needs were their number one priority. Gradually, he grew to trust, respect, and cherish everyone on the unit. He and his family ended up donating a chair to provide comfort and rest for those who provided comfort, rest, and assurance to him and his family.
Thank you, Kim. So can you talk more about the craft of storytelling in this context?
So I've been a storyteller long enough and have crafted enough autobiographical material because that's what I sort of specialize in. I have 3 one-woman storytelling shows, working on a 4th one. Next spring, it's going to come out. And I have a good sense of what is needed to make up a good story. So for listeners, like a story needs to be simple enough that we understand it. So a novel, we could have 100 characters and you could flip back and kind of say, who's that again? What one was this? So you could have that in a novel, but for stories, we need fewer characters. The action, there has to be action, the plot, the conflict, resolution needs to be clear. So not all of these have, plots. They do, I guess. But everything needs to be sort of clear. Images need to be clear. And the storyteller has a unique voice. And they get out the unique voice of each story there that we're collecting, which is a bit different for me. I'm used to using my own voice. But I think I'm a good listener, partly I think because of my disability, because I listen all the time, but also I'm very interested in people. But I listen, I think I'm also a good storyteller because I listen to language, the language that's used, the tones of voice, and I don't get distracted by visuals. Which can be very useful in a situation like a palliative care unit or hospital place where, maybe they don't look so good anymore. They've got tubes coming out of them. They got machines, they got this and that. My very first day working on a palliative care unit, because I started out my working life as a music therapist. And I was so nervous and I went into this ladies' room and I didn't know what to say to her and I was just nervous and I'm listening for things and trying to think, how can I start a conversation? And I heard a noise that to me sounded like a fish tank. So I said, oh, do you like fish? And she said, well, I'm sure she's thinking, who is this person? What I thought was a fish tank was her oxygen. And I finally told her, well, that sound, I thought was a fish tank. And she did laugh. The nurses had to come in because she laughed so much. And so ever after that, she would say to me, oh, my fish are doing well. We had this joke about it. But I think not seeing the visuals can be a good thing when you're trying to hone in on a story and focusing on the story. Not to say that sighted people can't do that, but I think that's a bit of an advantage for me. So I guess that's what I would say about crafting.
Yeah, so my next question, you've definitely already touched on it. So you have an interest in disability rights, and you describe yourself as a proudly blind storyteller. So why has this aspect of your lived experience has been so important in the project? You've already kind of talked about it, but is there anything else you would like to add?
Well, I think that when I started storytelling, I said, I'm not going to tell stories about disability, that there's no way, I'm not doing it. And then I started to do it. And that was what a lot of people loved and gravitated. And I loved it too. But partly I really felt that artists with disabilities are underrepresented and not heard in our society. And also people with disabilities are underrepresented, not heard in our society. And this kind of extends to this segment of the population, the palliative care patients, perhaps, the family members, caregivers. They're not heard about what it's like. If you're I'm sure Caitlin can attest that if you're a physician or some sort of staff working on the unit, you tell, oh, like either how can you do that? How would anyone do that? Or you're so wonderful, but not really listening to the experiences, the stories about that. So I think society thinks about fixing the disability, that we are less, we are sick, we are weaker, we're inspirational, but we're none of these things. And people on the unit are none of those things either. I mean, they are sick, if they're a patient on the unit, but they're still a person. So they're still the people who they are that happen to be having these disabilities or these diseases. They're still those people, and those people should be heard. Their stories should be heard and be worthy and important. so I've been blind since birth. I have no desire to see. It's a bit of a curiosity, but I'm not pining away for it because I wouldn't know what anything is. But that's not what society kind of views. So when I come up on projects like this, when you guys offered it to me or asked me if I was interested in this, giving voices to those who often do not have a voice, I get very excited by that. And I think I'm a good person to bring these voices forward because I know what it's to have others to speak for me and about me and have perceptions about me. And I think that's the case with this type of a project is people have perceptions or they speak for the person or they speak about the unit in a certain way. So I try not to do this for others. And I want, for example, the perception of the palliative care unit as being depressing, always depressing. But we can see from the stories that doesn't have to be the case. Like it's never one thing or the other thing. I also think that over the past years, since COVID, uh, voices of frontline staff have also probably been taken over by thoughts about the COVID and all of the things that went on around that, and that their voices are not being heard in the way that they should be too. So I wanted everyone to have their unique voices heard and listened to and turned into stories in such a way that's meaningful. Caregivers, they spend so much time helping, advocating, but again, their voices are not heard. Their voices can get lost in that. They're spending so much time, but we need to hear their voices. And I love in this case that all sides of life on this unit are being represented. So no one's being left out. The patients, the caregivers, and the staff, and all of their voices are heard, and all of their voices are appreciated. The other thing that I find I did say about my disability making me oblivious to things, but I also find it quite refreshing that people on the unit, they don't really care about my disability. They acknowledge me for who I am, which is a bit unique sometimes. Because when I pull out my Brailler, this machine that I'm reading my notes on, they don't say, oh, what's that? Oh, that's so wonderful. How could you do that? They just said, oh, I thought you were doing Braille. So, and when I come in with my guide dog, they just greet us and they're happy to see my dog. But the disability is not a concern for them because obviously they have bigger concerns than worrying about a blind person walking into their room and whether she can get around or how she got here or what she's doing with that thing brailing. It's really actually refreshing in a world where everyone likes to watch me and comment on me and have views about what I can or cannot do. It's kind of refreshing to be on the unit because I don't feel that there. And I don't know even why that is, except that, they are dealing with a lot, but even the staff there, they don't seem to bat an eye, they don't have concern about that. So that's very interesting. The other thing I think I realized is kind of jumping back to what I said about the uh, different ways to create the stories is I always have a disability lens in my head. And I also think about the amount of time that it takes some people with certain disabilities to do things. So we're trying to collect the stories in a way that respects that, like at a time that the person is most able to do this and that fits their schedules and not just my schedule, our schedules. And being flexible with time, being flexible with the length of session. Like if someone said, I could do it with you, but only 15 minutes or something, that's fine. Returning more than once if it's too tiring. We have returned a couple times to give stories and to get a little feedback. But we're trying to fit the project to them instead of them fitting it to us. So I think on a unit where I know that medical staff have their schedules and they do have to see people in a routine way and they have to do certain things, it's kind of nice to have someone that will acknowledge that they are going to fit themselves into your schedule instead of you fitting into them. So I am going to pause there and I'm going to read another story. This is a patient story that was collected by Jay and myself and was crafted by me. From her room on the palliative care unit, she is pondering questions, big questions. As she tries to find answers for some of these huge life questions, she also wonders about all of the other people around her on the unit. Are they pondering the same questions? What are they thinking? What are they feeling? What have their lives been like? She had a good life and has no regrets. Now, as she explores these deep questions, it feels like she is traveling along a road with many rabbit holes. You can pop down into a rabbit hole. Sometimes this is scary or somewhere you don't want to be. So then you can climb out, travel further down the road, and pop into another rabbit hole. Sometimes she ponders and thinks about the vastness of the universe, and it is too much. So she pulls herself back into her small corner of the universe, which is comfortable and safe. She also thinks about death. When all of this becomes too much and her brain is too full of thoughts, she climbs down the rabbit hole of mindless Netflix for a while. After this break, she is able to continue her exploration.
Thank you, Kim. I love that one. That's so many interesting images, and I'm just imagining when Rachel Gray gets to turn that into a film. That particular part is going to be particularly interesting, I think. So my next question is for both Caitlin and Kim. How can storytelling be applied in a broader sense in healthcare and healthcare education? And I'm going to start with Caitlin.
Okay. I think there's a role for storytelling in the broader healthcare context. Working in healthcare has moments that are challenging personally and professionally. It's not unique to palliative care or to physicians. Reflective writing initiatives are one way I think many team members might find beneficial to process what they're experiencing. And I also think healthcare workers, patients, family members all have important lived experience that can be helpful to inform artistic creation in many mediums. Patients and families undergoing a health challenge in general may benefit from opportunities to craft and share a story. I think it ties into concepts like helping other people go through the healthcare system after their own experience, ties into legacy and gratitude, all really powerful themes. Also, I think healthcare education, there's lots of exciting opportunities that exist now for reflective writing. And I know the ePortfolio curriculum at University of Ottawa I've been a part of and really enjoyed working with learners for reflective writing. And I think too, helping patients and families contribute to health education. And certainly that was really powerful in my own medical education journey. And so I think more of that would be great too.
Thank you.
Yeah, and in addition to that, I think collecting and sharing stories in healthcare education, it helps people learn. So even if you're not a storyteller, active listening, like reflecting back, collecting parts of their story makes them seem like a whole person and not just, a collection of parts or the disease or the disability. And I know that's tricky, I imagine, because you do have to, your job is to work on those diseases, disabilities, whatever you're doing. I mean, that is your job. But I think if you're thinking of the person as a person, it probably helps you to, to analyze that too, and to think about their life and how you might be able to help, their life as well.
Thank you. So my next question is, so for both Caitlin and Kim, so can you describe how the issue of privacy has come up in this project, and what were the participants' stipulations for sharing their stories? So Kim.
So before I answer that question, I'm
Yeah.
going to I'm going to do another story because I'm going to illustrate some points from this.
Yeah.
This is a patient story that was collected by me and crafted by me. She was a nurse, a world traveler, a quilter and knitter. One day, performing that simplest of most common of tasks, opening a pill bottle, her arm shattered and her tumultuous journey began. In the hospitals, she felt like a piece of furniture, cared for only in the most routine sort of way, not listened to when she said she did not want to or could not go home. She was sent home but could not cope there and ended up back in the hospital again. It was a long, hard road, but when she arrived on the palliative care unit, she felt like a queen, so cared for and loved. She loved that staff stood around her bed singing happy birthday, that they dropped in to chat, remembered her preferences, and helped her feel like herself again. Here she feels safe and saved. So I like to say people have been very generous sharing their thoughts and ideas and their stories with us. And there are some who are happy to provide them to sort of communications teams in the broader environment. But I think for the most part, they don't because they want to share their stories with us. They understand why they're sharing the stories with us. It's going to help research, is going to help other people contribute to, knowledge for other people and be a gift to other people, as I was saying before. They trust me to help create something that's authentic to them. And I'm really humbled by that trust. And so they don't want them sort of broken up into little snippets. So they've been hesitant because of that. They don't want their stories like torn up. So for example, if you think of that story, the last line is safe. She feels safe and saved. And someone could say, this poor person, suffering from this, saved by the Briere Palliative Care Unit. That was not the point of that story. The people, they don't want to be pitied or viewed as an inspiration. Like they don't want that. They want the stories to be shared, but in a very authentic way. And shared by people who understand, what the whole context of what they said. Because there's a lot, of notes that I have that, did not go into the story, but I tried to craft the story knowing the context of what I said, what they said. So this context. So I think we were concerned to make sure that their stories were safe with us, and that they were respected by us, and that when we shared them, we would do so in a respectful way and only as much or as little as they want to. So one of the questions is, do you want your name to show up in the story? Most people said no to that. And so we want them to have the freedom to tell the story and not be afraid that it's going to be taken and sort of torn apart and made into something that it's not.
Thank you, Kim. And Caitlin, what would your response to this question be?
I think Kim covered that so beautifully and in such an illustrative way. The only other thing I was going to add is that we do have research ethics board approval and, thinking of confidentiality in the research context as well, because this is a research project. But I think what has grounded all of their team members throughout the conversations is exactly what Kim has captured, which is a respect and appreciation for the gift participants are giving by participating in this project, and really that individual owns that story and has a say in terms of where it goes from after it's crafted. But Kim, that was beautiful. I think you captured that well.
Thank you.
Thank you, Caitlin. And my next question is also for you. Why did you choose to get involved in this project, and what has the experience meant to you as a doctor?
I'm going to start off by a disclaimer that writing is a little bit scary for me, and which is why I think working with Kim has been so valuable, and other members of the projects too. And I think, but I knew that it was worthwhile kind of exploring this because I think reading patient and physician and other healthcare providers' stories have had a big impact on my journey in medicine, particularly in palliative care. And I think that helped me to know I wasn't alone in some of the challenging questions I was wrestling with around cases and processing strong emotions in difficult cases. And I felt reading these stories also helped bridge some gaps between me and the provider I wanted to become, me and the, the patients I met. And so it was really powerful to the written stories I had read based on other people's experiences. I also really just enjoyed the opportunity to enter these creative spaces and conversations. I've always kind of enjoyed the arts, and so it's great to have an opportunity to, in a way, still be involved in those kind of conversations and creating something. So it's been really special.
Thank you, Caitlin. So I have one last question before we open things up to the rest of the group for conversation. What have you learned from working in a cross-disciplinary team? Let's start with Caitlin.
Sure. What I've learned, first of all, is that researchers, artists, and physicians make great teams. But honestly, I do feel our team is greater than the sum of the individual parts. And I think that it's just been such a cool team to be a part of, and I've really valued these meetings. And I think part of why it's worked so far really well for us is that a lot of us have been able to kind of and willing to step outside of our usual way of doing things and learn from one another, and recognize that we all bring different things to the table. And I think we've spoken openly and honestly when we needed to kind of reevaluate our processes too. But I think that's been a really unique team to be a part of, and I really value that. I also appreciate, again, part of that give and take and learning to work together as a group has also been figuring out scheduling challenges and things like that. And so I'm always really appreciative of the research team members and people coming from the artistic side, being understanding of physician schedules at times. But overall, I think it's just been really positive. And I think one of the first things I always talk about this project is just how special this collaboration is and how great it is to be in conversations beyond kind of your traditional sort of echo chamber, like just a group of physicians talking, and broadening kind of the collaborative teams. So I've just loved this.
And Kim.
Yeah, I've loved it a lot too. I really have. And I've learned a lot. I didn't know too much about the research side. I've always been sort of an artist and a music therapist. So like I didn't know a lot about that. So it's been really good to learn about that, about taking some of those ethics considerations for research. And of course, I'm not a doctor, so it's wonderful to sort of sit in a group of people and hear all the different perspectives and then try to mesh them all so that we can do this important work. So I love that we share our skills, we share our views, and we're all listened to and, given equal voices. I love the way that we work together and a unified team, like Caitlin said. It's a beautiful, nice team to be a part of. I really I appreciate everybody, and I'm just honored that they've took me on the team with them, because it is an amazing journey. Really, it's been a really good, amazing learning journey for me.
Thank you so much, Kim. And so I'm wondering if before we open the floor for questions, whether people would like to hear a couple more stories.
We could
Jerry,
do one and then do another one after
Yeah.
a while or something.
Yeah. Think so, Jerry? Okay. All right.
Okay.
Cool. Yeah.
So now I'm just a sec. Let me just see. Okay, so this is a caregiver story. I was just reading the first bit, so we know this is a caregiver story. As she sits in the palliative care unit with her husband of 60 years, she is remembering their life together. Today, she takes things one day at a time. But 60 years ago, she was a busy, young emergency room nurse, and he was an ambulance driver. Sometimes he took extra ambulance shifts, hoping that he would arrive at her hospital and see her. They had a very short courtship and soon were married. They promised till death do us part. As she looks back now, she remembers them saying those words and feeling strong, healthy, and invincible. He liked ambulance driving, but he'd always wanted to be a firefighter. He was accepted and soon was a fireman full-time. She has been a nurse, a mother, a caregiver for him and for other family members. As she sits with him now, she is grateful for the staff. She is also filled with wonder and gratitude for the firefighters who are a unique brotherhood and still surround them with support, even though he has been retired for more than 23 years. Yeah, that's the end of that one. Sorry. Yeah, that's the end of that one because it's another one, another caregiver. I almost ran into it. Also, I just want to say if anyone that can't write in the chat wants to ask questions, I'm sure you could raise your hand. And if you need to use the keyboard shortcuts, it's Alt-Y on the PC and Option Y on the Mac, and your unmute button on the bottom of your iDevice should be there. Your hand raised on the bottom of your iDevice should be there. If you want to ask verbally, I guess is what I'd say. Hope that's okay with you guys.
Okay, so let's give the rest of the group who is here with us an opportunity to ask some questions.
Hi, Jenny. Thank you, Kim and Caitlin. Thank you for such rich examples and really amazing insights into the power of the stories that you were telling. My question is really about things that were unexpected as you embarked on this journey, and maybe so I can ask Kim that question. What was it that you didn't expect that you came away with that was a pleasant surprise for you in this process, and maybe as well for you, Caitlin, as someone who's coming at it from a slightly different vantage point?
The thing I noticed, Jerry, is you barely get your bum in the chair and they're telling you stories. There is a real, almost like a compulsion for people to get stories out. It's quite unbelievable to me that that is the thing that, I don't want to say it surprised me because I know it's powerful, but it has sort of surprised me because you're barely getting the form signed. Poor Jay is trying to get the consent form and they're already sort of going into it. And, and we're writing away and it goes on a lot longer than maybe we anticipated a session being. But even if they say, I don't know what I'm going to tell you, but the minute you're sitting there, they do know. They don't know, but you know what I mean? They're telling you things. So that has been very surprising to me, and it shows the power of it. But I mean, just that whole fact that there's this real drive for them to do this has surprised me a little bit.
I was just going to add, one thing that surprised me is I've had an opportunity to read some of the stories that Kim shared today before, but hearing her present them in such a beautiful way, I was struck by my own sort of emotional response and just how excited I was to hear them and how moving some of the stories were. And so I think I was excitedly surprised by just how meaningful it was to hear you read the stories tonight, Kim.
Oh, thanks. It's hard to read them without getting emotional. I had to do them several times so that I could try to just do them justice without bawling on my braille machine or something, you know? Yeah. They're very rich stories. They're beautiful.
Carol?
Even though I was aware of some of those stories ahead of time, I echo Caitlin. It was really moving to hear them, and to think about the process of gathering and crafting. Now, Kim, I guess my question is, I still think, and even more so after today, you are the perfect person to be on this project. But I do want more of these projects to happen. So for people who aren't as perfect as you are, how do we expand this? Do you have some, like, is there going to be a Kim manual at the end of this that we can create to not just to have a wonderful artistic evening with the stories? I'm really looking forward to that, with stories and with visuals, but I'm also hoping that we can get storytellers going as a regular part of life in hospital, life in long-term care for people. And are you already thinking about tips and tricks so that other people can do this?
Yeah, and I would love to sort of do a workshop or create a thing. I don't know I don't know the way yet. Like I don't know the vehicle, but I would love to do that, and I'd love to do more of it myself. So I would really love to also do some more in various facilities, because that is also, Carol, you pointed out that others are asking for it, even as we do the research. Someone today, when we were on the unit, just said, "Are you doing them in the long-term care? Like, can we do them on other floors of the place where the palliative care unit is? Also has some long-term, floors of long-term residents there that could, not long-term care, well, some long-term, but, people, MS or, some disabilities for a long time. And people are asking, they are asking that question. Also, I think Jenny asked a bit about crafting, but I think one of the things that I've learned in this is I come home with my notes, I read them over, I write something down, and I go away from it. Then the next day I go back to it and I think about it. And all the time you're sort of percolating. So again, that process is longer than just like dash it off when you get home. It isn't like that because you want to try. I said at the beginning, and I feel a bit less of this now, that I felt a real pressure on me to do it justice. And I do, I guess, but it's getting less because most people said it's okay, it's good. Except the lady who was so cute who said, like, no, first she said it was perfect, and then she's reading it again. She, no, this sentence, no, that's not what I meant. And then, no, this sentence, please, could you change this sentence too? So so I think it would be a great idea to do something with this, to get it, because people are definitely saying, when we say we're doing it here, oh, well, could you do it? Long-term care, could you do it? Say at the rehab centers or, or other places too, like places where people are, and even people that are in there for rehab. Like I've met 2 people in the last couple of weeks when I came in, that are going home from rehab. And like, I'm sure they have stories about being in rehab and being, so yeah, I think there should be something. So I don't know quite what, but that's nice of you to say. And I would love to do more of it because it's very, very rewarding to me and enriching to me. But yes, I would like to help others to do that too.
Kim, this is Jerry, and it's exciting to see where an idea that started in 2019 has really come to. Because I remember some of those early workshops that we designed with Corey and Claudia and others, other patient partners, that it started like that, and now this is really, it's really enriched. And I love the fact that you're starting to ask those kind of questions, like where else could this go? Where else could this really make an impact? Because what you're doing is you're giving voice to people who may not otherwise have it, and this is a unique modality to do that. So yeah, I'm curious to hear from others on the call, like what are their thoughts on that possibility, and how do we help spread this idea?
It's Minka. I would be curious, you mentioned, Jenny, and some of the timeline around, some of the different processes in terms of sharing about this. So I was wondering if you and Carol and Kim and Caitlin could expand, either what you've collectively talked about, or maybe some other ideas about how you could share about this in order to grow it, I guess, is one method. And sorry if I spoke out of turn, because I'm just on my phone.
So like, yeah, one thing I did mention is that we're hoping to be doing, we are going to do, I'm going to be positive, is that we want to share this in an artistic fashion. So Kim is going to have kind of a, I don't know, maybe you're and kind of one kind of encompassing story that we are going to bring forward with us. And she is going to be working with Rachel Gray, who is a filmmaker and visual artist who does animation to create a film, but we're also hoping to have an art exhibition along with that. So we want, in addition to having this research through art to happen, to have sharing through art as well. But there are certainly other elements to the sharing. Serena, maybe you'd like to talk about that since you're here. Serena Eisenberg.
And put her on
Yeah.
the spot.
No, I'm happy to chat about it. So we've been having conversations as a group about additional funding opportunities that we can apply for to both expand the research as well as expand the knowledge dissemination, knowledge translation efforts. So as several people have already been talking about on the call, there's been comments that this can be expanded beyond palliative care to other patients in the hospital at Briere, to other hospitals, to other settings. And so applying for subsequent grants to expand this work, either within our local sites with Kim, or possibly finding ways to replicate Kim to have this work done in other settings. And then from a knowledge translation and dissemination standpoint, we are writing several grants to, as Jenny said, we hope we will be successful to have Kim collaborate with Rachel Gray to develop both visual and media art to share the stories. But we have also been in conversation with Briere about organizing an event for Kim to share the stories in other opportunities. So if anyone knows of funding opportunities that we could apply for that would allow us to expand the work either to other populations or just to share our findings in unique ways, we're all ears.
Absolutely.
One of the other groups that you were looking at with the study were the actual professionals on these units as well. What were some of the interesting things that you heard from them? What kind of aspects did you get any pushback? Were they supportive? Why were they supportive? If there was pushback, why was there pushback? I'm just very curious, because oftentimes that's also another area of tension, like of people being very protective of the unit that they find themselves working in.
Well, there's there's one staff story that I have here, but we did 2 more last week, and one was isn't done yet, but it's I would say I wouldn't say critical, but definitely the kind of services they could do better if they had, these services and so and so. Not critical of storytelling, but definitely, yeah, like 2 of the staff that we did stories for last week that aren't true stories yet, had definite views about some of the issues, some of the concerns that are going on. And I think it was worded and certainly Serena can correct me if I'm wrong, that one of the goals was also to help staff morale. Like, is it helping staff morale for staff to be doing this as well? How are they feeling with it? And is it, is it helping? So one of the stories, well, I can go find them, but it was a staff who also was a caregiver. So there's 2, I made 2 stories from her story because it was really confusing I'm just gonna, if you want it, I'm just gonna go find it and find them. Because it was really interesting to hear those 2 sides. I don't know if that's something you'd want right now, Jerry, or not.
Sure, that might be very helpful, just to listen.
Yeah.
Oh, Serena, I think you were gonna say something too.
Yeah, I was gonna say while Kim goes to find it, I was going to say that one of our intentions was a staff morale boosting, and especially as many of you know, during the pandemic, there were high rates of staff burnout across the board, and that was especially, or in particular, also observed among staff on the PCU. And so some of the research that we put into our initial grant application was talking about the proposed benefits to staff as helping them with self-care and reflection and enjoyment of their vocations. So that certainly was a component to what we were doing. I don't know, Caitlin, if there's something you were going to add to that.
No, that absolutely echoes what I was about to say, just that that was a huge motivation for me to join the project. We have a close-knit community of a variety of team members, nurses, allied health, physicians on the palliative care unit, and we had from COVID to other we lost a team member on our unit, like another staff member. We've had just a challenging, a very important but challenging area to work in palliative care, and so ways that we could try to offer something that might, it certainly doesn't solve problems that exist in healthcare necessarily, but it gives a space to kind of allow individuals to share more what they're experiencing, what they're feeling, and feeling heard, and it might become a part of something bigger. I thought that was a very meaningful way to get involved, and I think it sounds like it has started to have that kind of impact, and which is exciting to hear.
Yeah, so here are the connected, I mean, they're 2 separate stories. I listed one as staff and one as caregiver because she gave us a lot. Although she has worked at Briere for many years and visits the palliative care unit regularly, until her mom is placed on the unit, she realizes that she has never really witnessed firsthand the day-to-day work that goes on there. Her work is behind the scenes. When her mom becomes a patient on the unit, she is amazed and humbled by the frontline staff and the way they care for her and all of the other patients and families. It is so hard to believe that her mom is on this unit now, her dignified mom, who spent a lifetime volunteering, hosting themed parties, helping everyone around her, always immaculately dressed with perfect makeup and hair. Her mother has declined so rapidly before coming here. Her mom always said the only place she would want to go if she had to was to Briere. Because of her job, she is able to fight and advocate for her mom to come to the unit. Now she is within the circle of care. She is amazed every day by how caring everyone is. Nurses, doctors, cleaning staff, spiritual and social work volunteers, everyone. How they treat all their patients and families with respect, dignity, care, and love. The moment she will never forget was the ringing of the bell that signaled to staff and volunteers that her mom was leaving the unit. To see all of those volunteers and staff lining up in the halls to pay their respects to her mom, love and care shining even through their masks and visors. She is so proud to work here with these remarkable people. So that was the the staff story, but this is the related caregiver story. So it's sort of about the same, but a little bit different. So looking back, she is astonished at the speed with which her lively, energetic, dignified mom slipped away. At first, she did not know how bad things were. It was during COVID, and her family was not gathering in person like they usually did. Suddenly, her dad became the full-time caregiver for her mom. Her parents had been together since the age of 15. Instead of an anniversary party, she and her sister dropped off food and gifts on the porch. But after her mom's birthday, she visits the house regularly to help care for her mom and advocate for her services and supports for her. She is shocked and devastated watching her mom slip away so rapidly. Every day, more and more tasks she once did easily become impossible. Now that she and her sister understand the true gravity of the situation, they advocate and fight furiously for her mom to go to the Briere Palliative Care Unit. Both working in healthcare, they know the system and how to fight for what she needs. Her mom had always said that if she was sick, Briere was the only place she ever wanted to go. The advocacy battle is challenging and exhausting, but they persevere. She is admitted to the Briere Palliative Care Unit. On the unit, the staff care for them all, bringing her dad a coffee so he does not have to leave his wife's side, quietly cleaning the room and asking always if it is all right to come in, complimenting her mom on her beautiful skin, taking care of her and allowing her to die with dignity on the palliative care unit, giving the family help and support and expert care. Although this is one of the most difficult things that has ever happened to the family, the people of the unit helped them travel this difficult road and supported them with love, respect, and the best care possible. So that was a long interview and a lot of tears, and a lot of stuff came out. And I hope that it was somewhat along that path, what you said, Caitlin, like to help with morale, because, there was mention of COVID, there was mention of, being isolated, doing this, doing, all of the things that sort of encapsulated that time. It makes me want to cry to think about people saying goodbye, like through masks and visors. And I'm like, oh yeah, we all know. So I'm hoping that stories like that would illustrate that it hopefully has done that person good to bring those stories forward. It was done willingly, so I'm presuming so. Yeah. Anyway,
You have any other stories, Kim?
I have one more, I think. I think I have just one more. I can do that one. So this is from a caregiver. And I will say this one was interesting in that when we came in, that caregiver wanted to know our stories really a lot. What do you do and where did you come from and how? And I think we reflected afterwards that I think, like Caitlin said, it is boring on the unit. And if you're with your mom who's not speaking anymore and all that, people from the outside world are really interesting. And I think she's just interested in people. But it was an interesting discussion because she told us a lot, which I created the story from, but also wanted to know a lot as well from us. And said Ginger was the smartest dog she ever saw. So that that was kind of nice too. But anyway, so it was an interesting interaction because there was so much hunger for conversation in her. A lot of them, you sit down and it's sort of pouring out of them, and there's not a lot of conversation with us. But this lady wanted interaction and conversation with us. So this is the one for her. She stays here on the palliative care unit with her mom all day and all night. As she sits beside her mom and holds her hand, she is remembering her vibrant, strong mom. She thinks about her mom growing up in China and being the first woman in her family not to have bound feet. She remembers her parents working hard during her childhood and how they lived in a very regimented communal environment. Her parents were proud when she finished her undergraduate university studies. This was 1989 and students were protesting. They gathered and demanded reforms. The world watched, first with hope and then with horror, as famous protests were brutally repressed. She protested too, although she did not tell her parents. She was in another city, but was so disillusioned by her government and so mistrustful that she told her mom she had to go to the West. She knew no one there and she would be leaving her parents behind, but her mom told her to go. She won a full scholarship and her mom got the cash for her visa. Years later, in their 60s, her parents made the long journey to Canada and emigrated here. Here, where they feel proud to be Canadian. As she sits with her mom, she has gratitude and reflects on how beautifully staff and volunteers from all cultures are here working together, taking care of her and her mom. She is grateful for them and for the Canadian healthcare system and for her mom who helped her to get to a country where she could have an education, work, raise a family, and speak openly about her beliefs and feelings. So I struggled a bit with that one because of the like how to phrase certain things, but I mean, I said what she said. So, you know, I mean, sometimes you're giving back what they told you. So I don't think that might be the last one I have so far. You'll have to tune into future something or other for us to get. I'm just making sure that no, I don't have no more stories. Sorry about that. I can put my brailler away now.
How appropriate, Kim, to end off our session on a story. And I feel like that speaks to the overall kind of theme of what we're trying to do. So that's beautiful.
Yeah. Well, it's beautiful to have all of you interested in this, and it's beautiful to have Caitlin still working with us on the project, and Serena so supportive, and Jenny and Carol and everybody. Such a great team to, you know, to do this with. So, and Jaya, who's wonderful at escorting us around, figuring out where to go, and Ginger, who hangs out with us and gets a lot of pats from emotional people who are working on stories. So it's kind of nice too.
Thank you so much for what a rich conversation that we've been able to enjoy today. This has really been amazing. Kim and Caitlin and hearing those stories and the vulnerability in some of those stories has just been amazing. And Jenny, thank you for the questions that you were able to probe some of those ideas with them as well today. So thank you very much. With that, just a sincere thanks to everyone for being here. I hope you enjoyed the conversation and the discussion and some very practical opportunities to explore some of these ideas, maybe in the context that you find yourself, and build some of those collaborative partnerships as well. Keep this kind of work moving onwards and forwards as well.